Hello, I'm Nader Dahdaleh. I'm an associate professor of neurological surgery and orthopedic surgery at the Department of Neurosurgery at Northwestern University. I'm also the residency training program director at Northwestern University Feinberg School of Medicine. You're listening with an interview with the surgeon agent.
On this episode of Interview with the Surgeon, we welcome Dr. Nader Dahdaleh, Program Director of Neurosurgery at Northwestern University Feinberg School of Medicine, treating all surgical diseases of the brain and spine. He has special interests in minimally invasive spine surgery, spinal tumors, trauma, disorders affecting the craniovertebral junction, and spine biomechanics. He has over 200 peer-reviewed papers and book chapters and has published in high-profile journals including Nature Neuroscience, Cell, Proceedings of the National Academy of Sciences, American Journal of Human Genetics, Journal of Neurosurgery and Spine.
Hello, everyone, and thank you for joining Interview with the Surgeon. Today, we welcome Dr. Nader Dahdaleh, Program Director of Neurosurgery at Northwestern. Doc, how are we doing today?
Hi, how are you? Thanks for having me.
Thank you for being with us. So jumping right into this, what were your goals and aspirations during your residency, and how did those change throughout your fellowship?
Absolutely. My goals during residency were twofold. I wanted to maximize the time spent in residency in this very protected environment to acquire skills to become the best surgeon I can be in terms of achieving competency in treating various neurosurgical disorders. So just becoming an excellent neurosurgeon by spending as much time as I can taking care of patients before, during, and after surgery. So that was the first goal. The second goal, I wanted also to capitalize on the opportunity that we had at the University of Iowa. So I trained at the University of Iowa Hospitals and Clinics, and the philosophy there, as it is here at Northwestern, was to have graduating physicians who would leave an impact in the field. And the way they executed that vision is by having protected time during residency, and it was in Iowa, the fourth and fifth year of residency. So it's a 7-year residency program, but the fourth and fifth years are used as protected time, during which a resident would be either involved in scientific investigations, be either clinical or basic scientific, trying to get another degree during that time. And in this way, you want to set the stage after residency to get the best job possible or the best fellowship possible before you pursue your academic career. So the philosophy was to maximize the chances of having neurosurgeons or residents maximize their potential to leave an impact in the field and achieve their goals subsequent to residency. So during these 2 years, you can be involved in clinical investigation, get a degree in Masters of Science in Clinical Investigation or biostatistics if you want to pursue clinical research. And this would set the stage after residency to get the best job possible or academic job possible and or appropriate fellowship. So these are the twofold. So I tried to kind of achieve these two goals because my aspirations was to get into academic neurosurgery, and I think these 2 years really helped me get the excellent fellowship at Northwestern and then stay here as faculty. So build up my resume, became well versed in conducting clinical research and so forth. So these were my two goals: becoming technically the best surgeon possible, and then also trying to nourish my aspirations into becoming a clinical researcher.
So on that topic, can you kind of talk about your mentality heading into your first job search and how that perspective changed in the beginning years of your career?
The mentality was, since I wanted to land or find an academic job, because I just like academic neurosurgery. It gives you the opportunity to take care of patients, take care of complex neurosurgical disorders. In particular, my specialty is spinal surgery. That's number one. Number two, train residents. That's my passion too. Definitely the passion of any academic neurosurgeon is training and teaching and education. And the third thing is the ability to conduct clinical research that's meaningful, that may impact the field moving forward. So these were the three things that I was looking for in a job. Now, and there are many jobs, but however, the perfect job is not definitely open at all times. You need to explore different opportunities and try to find the job that can meet as many of the goals that you have in mind. So luckily, I had a few excellent job opportunities, and that I interviewed, and I found that Northwestern was the best place where I can meet my goals, long-term goals and short-term goals. I'm passionate about research, passionate about teaching residents. I'm currently the program director, so that's a very important part of my job, maybe the most important part of my job, in addition to taking care of patients, training the next generation of neurosurgeons. If we don't have providers and competent neurosurgeons, and who's going to take care of these patients? So that's as equal as important to me as patient care, and also trying to leave an impact and by conducting meaningful clinical research in a place that can do that has the infrastructure and the patient volume to be able to do that. So Northwestern was perfect. It's a very reputable program. Had a great history in terms of advancing different vascular neurosurgical techniques and definitely spinal techniques. Be it the legacy of Stephen Andra, who pioneered a lot of the deformity correction techniques, the understanding of the impact of spinal pelvic balance and impacting positively patient outcomes, as well as minimally invasive techniques, as with Dr. Fessler, who was here, who I trained under during my fellowship, and also credit to Dr. Koski, who continued Dr. Andra's legacy, and I spent a lot of time with him. He's my partner now, and I'm his partner actually now, and he's director of the spine program and the fellowship program here. We have excellent leadership here whose vision I totally understand, and it matches my own vision. So, yeah, I mean, this brings me to the point that if you want to work at a job, you want to make sure that your vision matches that of your bosses. So this should align, because this is the easiest way and the best way to succeed long term and advance in your promotion and your position. And the leadership of Dr. Lesniak is fantastic, and we work every day hard to making this department the best department possible.
Now, thinking on that, when you were going through the job market and the job search, did you ever consider going private practice, or were you really focused on academic all the way?
I definitely favored an academic job because it satisfies all my goals, but I kept my options open, and you always want to keep your options open and explore different environments and job opportunities. So I interviewed at a few private practice jobs or hospital-based jobs, one in St. Louis, one in Fairfax, and there were beautiful opportunities too. And different setup, more patient care focused, more than research. Some of them gives you the opportunity to do a little bit of research. It was great building relationships with people. It's a small community, but luckily I was able to find a great job at Northwestern. But definitely I explored other opportunities to meet people, to look at different perspectives. There are more positives and I think no negatives by interviewing and learning from other people's experiences, see how they set up things, see the technology that they use, the efficiency in terms of how they do things. So you learn so much from meeting people and interviewing at jobs. Most importantly, building relationships that last for a long time.
Now, can you kind of take us through the process of when you became an attending at Northwestern to then how you became the program director?
Absolutely. There's no specific process. It's the mindset, as you mentioned before. My mindset is to give it my all, work hard, and the most important thing is to love what you do. So if you love what you do, the job becomes easy. You look forward to going to work every day and give it your all and bring in your A game, and then things get, and then you achieve your goals, So the goals that you set will be achieved by having passion and giving it your all every day and working hard and having fun too at the same time. So if you're passionate about your job, then it becomes like your hobby. We have the infrastructure here and a lot of resources that help me, start my job and on a positive trajectory. So the mindset was, what are my goals? I wanted to have a robust clinical practice because primarily I'm a neurosurgeon, and that's what I signed up for. First and foremost is to take care of patients. So, being available and being able definitely helps. So you got to be available, like to junior faculty. The first 2 years are critical in building your practice and reputation. You got to be a surgeon with a lot of stamina, and you should have critical thinking. You should think about the pathology, make the right diagnosis, provide treatment plans, and do a good job during surgery. So that and minimize complications. And that's, you do that by bringing in your A game and being careful and prudent. Being available. If you want to build a practice, someone calls you for a consult. If you're on vacation every other week, it doesn't work. So, if you're available and a nice person to speak with and definitely capable, that helps you build your practice. Saying no is rare in my book, especially early on. Like, pleasure to serve attitude. So I learned this in Iowa, and we teach this to our resident. Our motto here is a pleasure to serve. So when someone seeks your help and assistance, the answer is always yes, and the answer is always positive, and you go and give it your all in terms of whatever task or whatever help that may be that you need to assist with. So that's key, and that comes with passion. You love what you do, then it becomes easy. So these are the things that helped me build my practice. Now, in terms of becoming a program director, I love teaching, and if you love teaching, then you form a bond with the residents. And then there was an opportunity to become assistant program director early on when I was hired, and you work your way up. You're assistant program director for 5 years. You get to know what are the ACGME requirements and how you make sure that your residents gets the best training possible. Their perception of education is important, and help form a curriculum and make sure that the feedback from residents exists and it's dynamic, open door policy. And then, after a few years, the residents and my co-faculty and also definitely my chairman entrusted me with becoming program director. Being passionate about education and teaching, that's what helps a person get into the education route, if you will, or niche, if you will. And the third thing is research. Being in a robust program with a lot of patients that you can, and the big databases internally and also national databases, we were able to mine them and ask appropriate questions and engage medical students and residents in doing serious clinical research.
Now, what would you say were some of the keys of your success that shaped your early career as you climbed the ranks in the academic world?
We go back to the same concept. The key to success is a pleasure to serve attitude, is being available, being honest, and bringing in your A game with anything you do. So, whether be it teaching residents, taking care of patients, writing a paper, just being thoughtful, and because anything that you do represents you, and that's the impression you want to give, and it's very fulfilling when you succeed in doing that. So key to success is being very thoughtful, available, passionate in what you do, and enthusiastic. Enthusiasm is contagious. People, and being easy to work with, and being a team player with high emotional intelligence, that helps. Now we're talking about emotional intelligence, I think one of the elements in becoming a leader in the field, and we teach that to our residents, more important than IQ and even technical skills, is being emotional intelligence, intelligent. And what does that mean? It's being self-awareness, not to decompensate under stress, having good communication skills, being professional, just being a good human being. But nurture, some in terms of emotional intelligence, is it nature or nurture? In my opinion, it's more nature than nurture. But if you're aware that it's important, then you can work on it, and that would help you definitely succeed in whatever you do, be it being a neurosurgeon or being a nurse or a provider, or any job that requires human interaction. Emotional intelligence is more important than skills and or intelligence.
Now, as you overseeing the program, what advice do you have for the graduating residents and fellows entering the professional job market for the first time?
Keep an open mind. Interview. Don't close doors. Build up relationships, and listen more than talk. Listen, see what other institutions have to offer, other individuals have to offer, and what you can bring to the table. You should always be your own champion, and if you want to look at a job, you want to say, okay, this job suits me, it's great, I'm covering 1 or 2 hospitals, many of my goals will be achieved. But the other thing, it's bi-directional. You want to think about, okay, what would I bring to the table? What makes me unique compared to other people who are interviewing for that same job, that makes me more amenable to getting the job that I want? So what do I bring to the table? And that's really important. You need to see what the environment there, the needs, and how can you contribute in a unique way that no one else can contribute in the same way to that job, so that you can say, okay, well, I'm the best person for this because so and so and so. Not only because only I can take care of patients, but I have skills that are either maybe unique clinical skills, maybe skills in entrepreneurship, skills in education, clinical research, basic scientific research, that would add to the strength of the existing department or institution. So how can I, what can I add? What things that I can bring to this institution that do not exist? So that will make the case for a person who interviews to maximize his or her chances of getting that job. What do I bring to the table?
Now, with the whirlwind right now, with the pandemic and a lot of these national conferences being done virtually or online, what advice do you have for the graduating class regarding their networking and outreaching process?
Stay hungry and work hard. If there's a will, there's a way. If you can't network physically because of the COVID pandemic, capitalize on the opportunity of, like this opportunity is fantastic. So if we didn't have COVID, probably this wouldn't have happened. Like me and us speaking, capitalize on online opportunities through Zoom meetings or Microsoft meetings that can happen virtually with, in times that, like, after hours, during weekends. Capitalize on that time, and capitalize on any opportunity that provides education, online learning. There are many virtual meetings. I'm involved in a couple right now. And this, the people communicating these days has been becoming seamless with the advanced technology in communication. So if there's a will, there's a way, and there's a huge way right now with the online platforms and opportunity to network across the globe, not even in the United States. Now I have friends during COVID that I network with across the globe, in the Middle East, in Europe, that only happened because of COVID and us we were forced to find a different way of communication, and this different way is just fantastic, and it's here to stay. Same thing with, for instance, telemedicine. Telemedicine is here to stay because of COVID. We can't stop taking care of patients, but we can do it in a safer way in terms of clinic encounters and visits through online opportunities. So after COVID, definitely we'll see more patients face to face, but but the convenience of telemedicine is definitely makes it here to stay. Same thing with online learning, online meetings, and networking. So you should always find a way to achieve your goals no matter what.
Now, there's a human element to being a neurosurgeon, and I'm curious if you can kind of give us what your advice or feedback would have been, thinking back what you know now when you were younger and situations that didn't come out as ideal in the OR or a loss of life. What advice would you have given to yourself then?
I learned that from my mentor, Patrick Hitchin. So we should, and I credit him with a lot of things that I do. And special thanks to Dr. Hitchin. He's like my other father, and he was my mentor in Iowa, and I did spinal surgery because of him. And I learned something from him. Celebrate with your patients and suffer with them. So if you have a complication, you got to think about it, and you need to suffer with the patient and with their families. It's easy to celebrate successes, but successes, you don't remember them all the time. What you remember, what sticks with you, and are your complications, and for instance, adverse events or poor outcomes, not necessarily because of negligence, because it's sometimes the nature of the disease. And that's where you need to, that's where the human aspect of neurosurgeons. We're treating patients after all, and each one of them have their own stories and they have their own families, and we need to be very empathetic. Comes back to empathizing with patients is part of one of the pillars of having high emotional intelligence, empathy. So not only you learn from it to do better with other patients, but you also got to spend time with that particular patient, be frank with them, be honest. I tell my patients, if there's a patient with a complication, you got to round on them twice, not once. We shy away from complications and we run towards successes because it's easy to celebrate. It's much more difficult to face a complication or difficult situation. So you got to empathize and be honest. Number two, you learn from it, but you got to show up the next day and do a better job. It's like throwing an interception. You got to come back and score a touchdown. So there's a balance. So there's a balance for the ultimate good. You got to suffer and take a step back, but you need to come back to work the next day, which is very difficult to do, and be focused on taking care of that next patient. And you gain this with experience, number one, with speaking, with having a great support system, great partners to speak with, and definitely seeking help when need be. Don't have a huge ego whereby if you're faced with a situation, not to consult with your senior partners, with your chairman, and with other experts in the field. So you got to stay humble, and it serves everyone. It serves everyone really well. Being humble, open to critique and criticisms, always wanting to learn and always wanting to get better. Like every day, okay, how can I get better the next day? What can I do to become more efficient? What can I do to minimize complications and maximize positive outcomes? My journey, it's not easy coming from I'm an international medical graduate. So I went to a fantastic university, American University of Beirut. It actually graduates many superstars in many different fields, graduates, ministers and entrepreneurs in the Middle East. So it's like the Harvard of the Middle East. I'm very proud of being a graduate of the American University of Beirut. However, getting into a residence in the United States, coming from an international medical school, it's not easy. And what I say is, if you work hard and you give it your all, you will achieve your goals. There's no way around it. And having a plan B is okay, but you don't want to have your plan B sway you away from your plan A. So you don't want to think, okay, I have a plan B, then I'm not focusing. I'm not going to give it my all towards my plan A goals. So you want to make sure that you stay focused, work hard, and enjoy the journey. Enjoy the journey.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.